Hello, I'm Dr. Zhou from the Cardiology Department, Chang Memorial Hospital. I would like to make a brief introduction of the training program for all of you who might be interested in joining us. The day work in our department contains several parts. Most of them will be included in the training program, such as visiting the inpatient ward, outpatient clinic, cath lab, EP lab, and the non-invasive examination. In the course of inpatient ward and outpatient clinic, you can meet the patients with different clinical scenarios and discuss with our senior staffs. You can also join our teaching activities, including the heart sound simulator for learning of the physical examination in cardiology. In the course of cardiac cath, you can learn and understand how we perform intervention procedures for different cardiovascular diseases, such as intervention of coronary artery disease, whether in patients with stable CAD or AMI. You can also discuss with the operators about the rationale and the skill of these procedures. In addition to coronary intervention, we also perform intervention for peripheral artery disease. For example, intervention for patients with intermittent claudication due to PAD, critical limb ischemia with unhealing wound over foot, carotid artery stenting, and renal artery stenting. From time to time, we perform intervention for valvular heart disease, such as Transcatheter aortic-valve replacement for severe aortic stenosis, or MitraClip for severe mitral regurgitation. Occasionally, we also perform intervention for acute pulmonary embolism or balloon angioplasty for CTEPH. This picture shows the procedure of TAVR is currently the trend of treating severe aortic stenosis in patients with moderate or high surgical risk. This picture showed how the procedure of MitraClip is performed. For patients with severe MR and high surgical risk, it is a less invasive, safer, and effective procedure. In case we happen to perform the TAVR or MitraClip during your stay, you will be welcomed to join us in these procedures. Besides cardiac cath, another field in the cardiology is the electrophysiological studies. It includes two parts. First is the device therapy, like pacemaker for bradyarrhythmia, implantable cardioverter defibrillator for VT and VF, and the cardiac resynchronization therapy for heart failure. Second is the electrophysiological studies and aberration of tachyarrhythmias, such as PSVT, atrial flutter, paroxysmal or persistent atrial fibrillation, and ventricular tachycardia. In this course, you can observe these procedures and discuss with our EPS experts. Recently, there are several advanced techniques in the EPS fields, and most of them are also performed in our lab. This picture showed the leadless pacemaker, different from the traditional ones. Only the pacemaker lead is left in the RV septum, without connection of the pacemaker wires. Another advancement is the OAA occluder for stroke prevention of atrial fibrillation, especially in patients who cannot tolerate anticoagulants. The picture in the right side showed the his bundle pacing, which probably attenuates the adverse effects of traditional RV pacing. This slide showed the recently developed method for ablation of atrial fibrillation, the cryo balloon ablation. It is as effective and safe as traditional radiofrequency ablation for AFib, but it's more simple and less time-consuming. All of these above techniques were performed in our EP lab, and you may observe and understand the procedures during this course. So welcome to join us in your future learning program, and wish you have a wonderful journey during your stay in Taiwan. Thank you.